Endometriosis is a chronic, often painful condition in which tissue that resembles the lining of the uterus, known as the endometrium, grows outside the uterus. This tissue can attach to the ovaries, fallopian tubes, the outer surface of the uterus, and other organs within the pelvic area. Despite being outside the uterus, this tissue still responds to hormonal changes, leading to inflammation, pain, and sometimes scar tissue formation. The exact cause isn't fully known. However, there are several theories. One is retrograde menstruation, when menstrual blood flows backward through the fallopian tubes into the pelvis. Another theory involves embryonic cell transformation, where certain cells turn into endometrial-like cells under hormonal influence. Endometriosis may also spread through the lymphatic system or be triggered by immune system disorders that fail to recognize and destroy abnormal tissue. Finally, genetics may play a role, as the condition often runs in families. Symptoms can vary widely. Some women experience intense discomfort, while others have no symptoms at all. The most common symptom is pelvic pain, especially during menstruation. Other signs include painful periods or dysmenorrhea, pain during or after sex, painful bowel movements or urination, especially during your period, heavy bleeding, either during or between periods, fatigue, bloating, constipation, or nausea. Importantly, infertility may also be a symptom and a reason many women discover they have the condition. Diagnosis usually starts with a detailed medical history and physical exam. Imaging tests, like ultrasound or MRI, can help detect abnormalities such as ovarian cysts. However, the gold standard for diagnosis is laparoscopy, a minor surgical procedure that allows a doctor to look inside the pelvis and take tissue samples if needed. Treatment depends on how severe the symptoms are and whether the woman wants to become pregnant. Options include medications like pain relievers, such as ibuprofen, and hormone therapies that reduce or stop menstruation, such as birth control pills, progestins, or medications that suppress estrogen. Surgery may be used to remove endometrial growths, especially in cases of severe pain or when fertility is affected. In some extreme cases, a hysterectomy or removal of the uterus may be considered, though this is usually a last resort. For women trying to conceive, fertility treatments, such as IVF, may be recommended. Lifestyle changes, including a healthy diet, regular exercise, and stress management, can also help manage symptoms. Endometriosis can lead to several complications. Infertility, which affects up to 50% of women with the condition. Chronic pelvic pain, which can impact daily life. Ovarian cysts, called endometriomas. Adhesions, which are bands of scar tissue that may bind organs together. And in rare cases, there's an increased risk of ovarian cancer. Living with endometriosis can also take a toll on mental and emotional health, leading to anxiety or depression. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.